First, I want to say thank you, Chairwoman Waters, for renewing this committee's sense of urgency around this issue and reframing the conversation to reflect the real gravity of it. In 2013, a national infrastructure protection plan was released outlining 16 critical infrastructure sectors. Of the 16, not one was housing or shelter. Just to be clear for the purposes of the record, would the four of you indicate by show of hands, do you believe it is vital that we recognize our nation's housing supply as critical infrastructure if we are serious about addressing our current housing crisis? Show of hands. Yes. Let the record reflect. Okay, enthusiastic showing. Thank you. In cities across the country, including those in my district, the Massachusetts 7th, the housing supply lacks both in quantity and quality. In Cambridge, one housing property alone vacated 57 housing units as a result of hazardous mold. Now, we know that multifamily units and apartments house a large proportion of low-income families, and while some are in good shape, many of these buildings have deteriorated and do require significant renovations. Unfortunately, these situations are plagued by split incentives, where owners see repairs more as sunken costs than as investments in their properties. Mr. Carter, would you say that because of split incentive, many building owners choose not to make these needed repairs, and many residents contend with poor and subpar housing conditions?
I would say that as an industry, I believe that, and I know as a company, we focus on making those investments because the most important thing to us is the safety and wellness of our residents. So we do make those investments and we cure those situations.
Would anyone else like to comment before I move on? Mr. Lawson?
I would just say that within the industry, within any industry, there are good participants and there are bad participants. And we all know that there are a small percentage, I think, of landlords who do not keep up their building. We welcome, as an industry, we welcome our local codes officials putting pressure. We think they should be even more aggressive.
Reclaiming my time. Okay, very good. When I serve on the City Council, I chair the Public Health Committee, and we spoke often about the weathering effect that we learned about through the Mass Community Health Center, where they surveyed low-income residents in public housing about how bad did they think their children's asthma rates were. And they put it in like the 3 to 5 range, but when they were tested, they were actually at life-threatening risk, 8 to 10. And so we know that housing is a fundamental and critical determinant of public health. And repeated studies have shown this link between housing stability and health outcomes. The current state of much of our housing supply poses a literal hazard to families and particularly children. One 2-year study by the Boston Housing Authority at the Mary Ellen McCormick neighborhood found a 47% reduction rate in asthma symptoms, asthma attacks, ER visits, school absences when tenants moved out of older apartments into newly renovated units. This reality is no clearer than with the story of a constituent of mine, Angelo, who first came to the Boston Medical Center Grow Clinic at 8 months old, but was the size of a 4-month-old. He and his mom were living in an overcrowded apartment, sleeping in the living room with a leaking ceiling, infestations of mice and cockroaches, among other things. He developed allergies and was so weak he could not raise his head up. Since then, as a result of moving into quality public housing, he has now started to thrive, to gain weight, and hit the necessary developmental milestones to enroll in daycare. Ms. Yentel, do you agree that housing is a critical determinant of health?
Absolutely, and if I could add, I would say I think you raised such an important point, not only for the individual costs to children and to families, but to the federal government through inaction. So we're talking a lot about what are the benefits of a major investment and infusion of funds to repair public housing and build more. Inaction is expensive. We're paying for housing instability and homelessness one way or another, and as you raised, we're paying for it through increased health costs. When people are affordably housed, their visits to primary care physicians increase by 22%, their visits to the emergency room decrease by 18%, Medicaid costs fall by 12%. There was a study in your backyard from Children's Health Watch in a group of pediatricians out of Boston that found that over the next 10 years, we will spend $111 billion in avoidable health care costs because of housing instability and housing insecurity.
And so one more time, just for the record, in your opinion, do you believe the current level of funding poses a risk to the public health of our children and families?
I do. Yes.
Thank you. And I yield back.